Most people who are told they have nerve compression from a disc herniation or a pinched nerve in their back, they're never told, what does that actually mean? Terms are thrown around like impingement, effacement, encroachment, or nerve abutment. They sound serious, but most people are never shown what those words actually mean, how they connect to the leg pain, the numbness, or the weakness that person feels every day. In this video, I am going to translate the exact language radiologists use in lumbar spine MRI reports into plain English, so you know what is really happening to the nerve and explain why certain findings cause certain symptoms while others don't. And later, I'll walk you through the structured multi-step approach that we use with hundreds of patients to reduce nerve irritation, relieve leg pain, back pain, and get back to normal life. After we understand that, then we'll figure out what MRIs are actually saying. Hi, I am Dr. Chris Cameron, a chiropractor here in Lucan, Ontario. I help people with degenerative spinal conditions like back pain, neck pain, disc bulges, disc herniations, sciatica, help them to overcome their pain, improve their health, and get back to doing the things that they love to do, all through safe, non-surgical corrective methods. On this channel, you'll find practical tips, insights on how to manage back and neck pain, healing discs, and improve just overall spinal health. Before we dive in, make sure you subscribe so you don't miss any new videos on how to strengthen your spine, enhance your well-being, and live a more active, fulfilling life. I upload a new video each and every week. When a doctor tells you that you have a nerve compression from a disc herniation, or says you have a pinched nerve in your back, they're not inventing a diagnosis, they're just summarizing what your MRI report shows in simple language. The problem is, though, simple language often hides important details, and without those details, it's hard to understand why you're feeling the way you are. What's actually happening starts with the disc. A herniated disc means that the part of the disc has pushed beyond where it normally sits, and that material can now move into spaces where nerves travel, especially in the lower back. When that happens, the nerves, they don't just get pinched like a light switch being flipped on or off. Instead, it's usually irritated over time in varying degrees, depending on how much space it has. It may be crowded, stretched, flattened, or simply touched in a way that disrupts how that nerve functions. That's why the symptoms are often in the leg rather than in the back. That nerve in your lower spine, it travels down through your hips, thigh, calf, and into the foot. When one of those nerves is irritated, it can cause radiculopathy. That's just a fancy medical term for shooting pain down into the leg, burning or electric sensations, numbness or tingling, or even leg weakness. The location of your symptoms often follows the path of the specific nerve that's involved. This is also why two people can have the same disc herniation and feel completely different. One person may have that intense sciatic pain shooting down their leg. Another may feel mild tingling. Someone else may have weakness but very little pain. The word nerve compression and pinched nerve, they don't explain the difference on their own. The detail in the MRI report do. And this is where most confusion comes from. MRI reports use very specific terms to describe how a disc is interacting with a nerve. Words like impingement, effacement, encroachment, or nerve abutment are not interchangeable, and they don't all mean the same thing or same kind of problem. Some describe mild contact to a nerve, that don't cause symptoms. Others describe pressure that clearly explains the leg pain, numbness, or weakness. So before we talk about treatment or how to relieve nerve compression, you need to understand what those words actually mean and where they fall on the spectrum from mild to severe. In a moment, I am going to break down the most common MRI terms used to describe nerve compression, explain them in plain English, and show you how each one of them typically relates to symptoms that someone might feel. When you look at an MRI report, the language can feel overwhelming. That's because radiologists are trained to be precise, not reassuring. Words like effacement, encroachment, and stenosis sound serious, but they are simply describing how much space a nerve has and how it's being affected by nearby structures. The most helpful way to understand these terms is to see them as pointing along a spectrum from minimal contact, which cause no symptoms, to clear pressure that explains leg pain, numbness, and weakness. Every nerve in your lower back lives in a defined space. MRI terms describe how much breathing room that nerve has left. One end of the spectrum, there is plenty of space and often no symptoms at all. On the other end of the spectrum, there's real pressure that clearly explains severe leg pain, numbness, or weakness. Most people fall somewhere in between. On the mildest side, at that end of the spectrum, you hear terms like contact or nerve abutment. This simply means the disc is touching the nerve, but not pressing on it. Think of it like two people standing in an elevator. They're touching, but they're not pushing one another. Many people have this finding and they feel really not much in the way of symptoms at all. If symptoms are present, they're usually intermittent, maybe some tingling or discomfort in certain positions. This is why MRI findings alone don't always equal pain. As we move up the spectrum, you'll see words like encroachment or narrowing. This tells us that the space the nerve lives in is getting smaller. For example, the elevator walls are now moving in. The nerve still has room, but it has less flexibility. At this stage, symptoms are often dependent on activity. Sitting too long, driving, bending, or being on your feet all day can trigger leg pain, numbness. The nerve isn't crushed, but it's under some stress. Then we reach important terms like effacement. Every spinal nerve is normally surrounded by a small cushion of fat that protects it. Effacement means that that cushion has been squeezed away. The nerve is now being pushed against something. You're pinned up against the side of an elevator. This usually lines up with more consistent daily symptoms. People often describe deep ache, burning pain, tingling that follows a clear path in the leg. At this point, MRI findings and symptoms tend to match up much more clearly than the previous ones. Further along the spectrum are terms like nerve impingement or nerve root compression. This means that there is actual physical pressure interfering with how the nerve is functioning. The elevator door is now pressing against you. This is where sharp, electric leg pain, noticeable weakness, heaviness, or difficulty walking can show up. The MRI will often specify where this is happening, like foraminal stenosis, where the nerve exits the spine, lateral recess stenosis, where it travels, or central canal stenosis in the main spinal canal. The most important takeaway from this: these MRI terms describe degrees of space, pressure, and irritation. They are not all equal, and they don't all require the same solution. A nerve that is mildly encroached needs a very different approach than a nerve that is severely compressed. And when you look at a nerve compression this way, it becomes clear why a single solution rarely ever works long term. Approaches like medication, injections, exercise, or one therapy at a time often fall short. That's why we use a structured multimodal approach. Once you understand what nerve compression actually means, the next question is usually why the things you've already tried haven't fully worked. Pain meds, injections, exercise, single therapies can reduce symptoms, but most of the time they're only addressing one part of the problem. Nerve compression from a disc herniation isn't caused by just one issue. There's loss of space around the nerve, inflammation that keeps the nerve irritated, reduced blood flow that slows the healing process, and mechanical stress from how the spine moves and loads throughout the day. Treating only one of these factors is like fixing a leaky pipe without turning the water off. You might feel temporary relief, but the underlying stress of the nerve remains. For example, medication may calm inflammation, but doesn't change disc pressure. An injection may reduce pain temporarily, but won't restore movement stability. Exercises can be helpful, but if the nerve is still under pressure, they often flare symptoms instead of resolving them. Even combining one or two of these approaches usually isn't enough for more serious cases of nerve compression. That's why lasting improvement typically requires a structured, multimodal approach, one that reduces pressure on the nerve, improves circulation and tissue healing, restores healthy movement, and supports the spine between visits. That's exactly what our BackStrong protocol is designed to do. To address nerve compression the right way, we use a systematic, science-backed, results-driven process called the BackStrong Protocol. It's an 8-step plan designed to reduce pressure on the nerve, calm irritation, help the spine heal in a way that lasts. I have an entire video dedicated to walking you through this protocol in detail, and I will link that in the description down below. Using the BackStrong protocol, we've seen 78% of our lumbar disc herniation patients and 67% of our spinal stenosis patients report a 50% improvement in their symptoms after 3 months of care. Step 1 is warm-up. This prepares the lower back and surrounding muscles for care by increasing blood flow, reducing tension, which makes every step that follows more effective and more comfortable. Step 2 is deep tissue class 4 laser. This targets deep tissue to reduce inflammation, improve circulation, and support cellular healing at the disc and irritated nerve. Step 3, non-surgical spinal decompression. This step gently reduces pressure inside the disc, helping to create space for the nerve and allowing that bulging disc material to retract away from the spine. Step 4 is chiropractic care. Adjustments restore proper motion to the spinal joints, improving disc nutrition and support long-term spinal stability without stressing the injured area. Step number 5 is the BackMax belt. This provides external support to help cushion stay in place and reduce daily stress on the injured discs and nerves. Step 6 focuses on customized nutrition and supplementation. This helps lower inflammation and gives the body the building blocks it needs to repair discs and connective tissue. 7, a customized rehabilitation program. These exercises strengthen the core and stabilizing muscles so improvements last and re-injury is less likely to occur. Step 8 is custom orthotics when needed. These correct gait and alignment issues that can quietly overload the lower back and delay healing. This structured approach allows us to address nerve compression from every angle rather than relying on a single solution that rarely holds up long term. You should now have a much clearer understanding of what nerve compression actually means with disc herniation and how the language in your MRI report relates to the symptoms you may be feeling. Now, if this video gave you clarity or helped something finally make sense, please like it and share it with someone who may be feeling confused or worried about their MRI results. If you have questions about your own MRI report, leave a comment below and let me know. I read every single comment and they often help shape future videos. And remember to subscribe so you don't miss new videos on how to strengthen your spine and improve your overall well-being. If you want to learn more about the BackStrong protocol, I go into much greater detail in this video. Go ahead and watch that now.